hear me?
What are you? Yeah, we can hear you perfectly.
Okay.
So what are you presenting us today?
Okay. Okay. Welcome back to the San Donato Cat Lab. Before to start, just a quick introduction of the team. Davide Abbiate, our radiologist technician. Fabio D'Aiello, the fellow, our young colleague. A special guest, Shiva Kumar, that is working with us, all the nurses, and also Angelo Micheletti, that is going to introduce the case with Antonio Saracino, and the anesthesiologist. Of course, we also have the patient. Let's start, Angelo, to show all the slides about this patient. The PowerPoint.
This is a 10-year-old girl who had a cardiac murmur heard during childhood by the family physician. She had a complete cardiology assessment and a moderate size secundum ASD was diagnosed. She is currently completely asymptomatic. On physical examination, the body weight is around 50 kilos, and there is a wide fixed splitting of the second sound, and the soft ejection systolic murmur best audible at the upper sternal edge. ECG is unremarkable, and chest X-ray shows some increased vascular markings due to the high pulmonary blood flow. Transthoracic echo shows a secundum ASD with good superior and inferior margin and deficiency of the aortic rim. And here you can appreciate some right ventricular volume overload. So intended procedure is percutaneous ASD device closure.
Okay, Angelo, please, can you show the TOE, please? 2D, yes. 3D, a comment on that.
Okay,
Echo live. Echo live. Perfect.
Okay, we can go through the 2D pictures at first, and here you can appreciate the posterior margin and the deficiency of the aortic rim. Go ahead. And we measure here about 12 millimeter. And again here, near the bicaval view, we measure about 11 millimeter. So good superior and inferior and posterior margin, but deficiency of the aortic rim. And then we can move to the 3D reconstruction and picture. This is a anatomically oriented view from the right side. And here you can appreciate the oval fossa defect. And here, up here, you see the entry of the superior vena cava, down left the entry of the inferior vena cava. Following the arrow here, on my right side, there is the tricuspid valve, upright, there is the aortic valve. And then we can see the defect from the left side on a 3D. And here you can appreciate, down here is the aorta. This is the defect with some elliptic shape. And we did some measurements. And we got about 14 by 10 millimeter.
Okay, back to us. Any question from the audience at this stage? Any comment?
This is Jose Luis today from Madrid, one of the panelists. A couple of comments. Are you thinking about to apply what kind of occluder? You are using, for example, the Bore septal occluder, because I don't have experience, only a couple of cases, but in Spain there are a couple of centers with a nice experience in this particular case, with a very, very short or absent, completely absent of the retroaortic ring. And other thing that we have to pay attention in this kind of patient is not only the absence of the deficiency, the short rings in the retroaortic side, is the combination with the floppy or short inferior cava vein ring. This combination could provoke any kind of delay embolization, and I'm really worried. Indeed, actually, we prefer to send this patient to operating theater with
Yes, about the first question, I will answer.
Yeah, we share your concerns, but there is a lot of experience now, even in the presence of a floppy inferior and posterior margins. ASD has been closed in transcatheter route with good safety. You can say that there is a small stub of a retroaortic margin, but when Dr. Angela was showing the bicaval view, you can appreciate that there was a good superior margin. And so I think it is one of the safer candidates for a transcatheter ASD closure.
Yes, about the idea to use a Gore cardioform device. We don't have an ASD Gore cardioform device. As you know, we are quite a significant experience using the PFO Gore cardioform device for small ASDs in children with deficient aortic rim. But we prefer, okay? So just one question, do you suggest to size the defect?
Let me just say one thing. Just show us what you are now want to do, because we don't want to have too much discussions beforehand. We
Okay.
have seen the defect in 3D, so the first question would be, do you do balloon sizing or not, and have you already enough information to make a decision what kind of device you will choose, please?
We wanted to know your view about whether you want to see the balloon sizing. In case if we are going only by the transesophageal echocardiographic measurement, it is around 12 millimeters. And on three-dimensional echocardiography, the vertical longest dimension was around 14. So what sort of device we should be choosing? If we are going only by the static pictures of two-dimensional echocardiography, it's around 12, and on 3D it's 14 by 10. So we may be tempted to use a 15 Occlutech ASD device. But I understand that it's a very common practice in the whole of Europe to do a balloon sizing, even though we don't do it at all in our country. So since it is...
Okay, so we don't want to urge you to do anything in another way than you do it normally. So I would say just go ahead and show us how it works.
Okay,
So we have to take a 15 millimeter Occlutech device.
Okay, can you prepare the...
Defect, right?
Yeah, but
Okay.
let me tell you, we are...
So please.
We wanted to see the ballooning also. So when we were using the balloon and we are going by the stop flow, can you show the picture? This is the ballooning, the first attempt, where there was a trickle of flows on echocardiography, and this measured about 13.8.
The size?
Okay, it is measured about 14, and the next one, this is a corresponding picture. Can you show the screen? Can you show the transesophageal that is being done
echo,
during
please.
the balloon? Echo, please.
Echo, please,
Show
on
the
the
echo,
screen.
please.
Okay.
Yeah, this is the corresponding echo. And here we got, echocardiographically, we got anywhere around, this is 16, but we also got somewhere around 15. This is 15 millimeter. So in this particular patient, the balloon sizing did not significantly change the dimensions, even though in some of the patients we have observed that the balloon sizing might give significant higher estimate. What do you see?
Okay, yeah.
Especially in
Very good.
Okay.
so we have stuck to the
So same diameters.
yeah we
I
are,
would say just go ahead and show you how you perform.
Okay,
it.
let's go.
We will go back to Leuven in about 10 minutes.
okay.
Well,
Can you show the
I don't know
device?
how far you are with your preparation.
Okay.
But I would say here are no
So we'll change.
objections, no discussions. Everyone needs to be quite happy with your decision. There's no concerns about the lack of rim behind your aorta so far. I think we can do perhaps this discussion once the device is in place.
Okay. So currently we are putting in,
I would say just go ahead.
okay, currently we are putting in a 9 French Occlutech delivery system
Sì, mi devi aprire qua.
through the wire,
Devi fare così, ok?
and Dr. Massimo is loading the 15 millimeter.
Okay. You see the device here. Everybody knows him. It's very soft. It's a Flex 2 device. Okay, open it.
We put it under water seal or what is
Open
it?
it. Okay.
Excellent. We can
Okay,
see it
close.
as well. Just go
Okay,
ahead.
okay, close it. Okay, okay. It's tilting perfectly. No. Open it. Okay. Okay. No. Okay. Okay, fix it. Turn a little bit. Okay. Perfect. Okay. You see, it's tilting up to 50, 55 is a perfect. Also to get information before to release the device about the final position. So maybe we can flash it.
Yeah. You just flashed.
Okay, we flashed. Okay.
Yeah.
Okay. Flash it. We can download it. Okay.
Yeah, Massimo, we see it very clearly.
Okay.
Just have to inform you that we have to switch to Lumen in 5 minutes because satellite time
Okay.
will be then
Okay.
at its end, and we have a case left there
Okay.
with a
Okay.
still unoccluded Vino connection to the right atrium, which
Okay.
Mark is about to
Okay.
do. So in 5
We'll do
minutes
it
we have
in
to change.
2 minutes.
But
Okay.
if you are straightforward,
Okay.
and, yeah, please go ahead.
Okay.
So we are loading the 15 millimeter.
So you see we are opening the left one. Just turn a little bit counterclockwise. Okay. I think it's the right position now, in the right spot. Can you show the color?
On bi-cable also?
Okay. So we can release
Okay.
it. if
Yeah.
you
The device
shut
seems
that.
On
fine,
a 0 degree view, a horizontal.
nicely placed.
So
Okay.
this looks good to me, but
Yes.
We'll do a.
we see it from very far away. Any comments from the audience?
I'll make a small cine so that you can see the picture
Obliqua.
better.
Metti obliqua.
See?
Okay. Push the pedal. Push the pedal. Okay.
Now we'll see a 0 degree view also
Yes.
there. Can
Zero-
you-
zero
0
degree?
degree? Yeah.
I think we are in the right spot. Okay.
Okay. Can I do a subtle wiggle?
Yeah.
Okay.
Okay. We can release
So
it. I think so.
tell us, what are you about to do at
Yeah.
the moment?
We're planning to release it. What are you happy?
Yeah, perhaps a little bit of, yeah, now
We're-
it looks
we're
good.
happy with the
And then
images?
a little bit of push.
Push a little bit. Yeah.
So raise your hands in the audience who would like to release it now. Please hands up. Releasing. Some are for releasing.
Doc,
So
can you
who wants to
push up
have
and
more
pull up
information
the
before
probe?
releasing?
There?
Spingi sotto la cosa.
Well, the majority doesn't raise hands at all, but the small majority of those who rose her hands, have risen her hands, say you can release it.
Can show 90 degree also once?
90?
Looks like
Yes.
it's pushed.
Okay, Massimo, unfortunately we have to go to Leuven now.
Okay.
Because,
Okay, we release it.
forces
Okay.
us to do so.
We release
we'll
it.
come back to you in
Okay.
a few minutes.
Okay.
And then we look at the result of this.
Okay,
device,
perfect. Okay.
Yeah, in a few minutes.
Okay, see you later.
Thank you. Let's go back to San Donato and the ASD.
Okay?
Massimo, can you hear us?
Yes, we can hear you. And maybe you can see the pictures now. We tested the device before to release it. You see the pictures? Okay. Okay.
Yeah,
Then
we can see it very clearly.
okay, then we release. Okay, we are testing the device, then we release it. You see there is not a significant tilt, and then you see also the echo, 2D and 3D.
Yeah, very good.
Shiva, any comment?
Yeah, it was a probably very simple patient.
Yeah.
Okay, the flat device is popping a little bit, has grip to all sides. From here it looks fine, a little bit of residual shunt through the meshes of the device. 3D looks good. What about the missing rim or the minimal rim behind the aorta? Are you happy with the configuration behind the aorta?
It looks okay. The doctor, can you can now appreciate the retroaortic margin here. Can you show around 45-degree view, doctor?
Okay.
Show is there any is there any residual flow at the anterior edge now? We go to around 45 or so. Yeah.
Yes, it's a very
Actually,
soft device.
the deficiency of the retroaortic margin was not for a larger circumference of the defect. It was probably very small. It is sitting very nicely. Can you put some color there, doctor?
Okay.
Yeah, we can see some trickle of flow along the anterior edge. But that is between the two discs. I'm sure it'll close off by the time the heparin effect goes off. We gave an additional dose of heparin.
I mean, this is a good result. We see there's some residual shunt. We expect that this will close in a few hours to days.
Yeah.
And any questions to this case from the audience with regard to the missing rim, to the residual shunt, to the procedure itself? Nobody raises
Okay.
his hand. So thank you to San Donato.
Back to us. Thank you.
Thank you for the case.
Thank you.
We will continue with our presentation. Thank you.
Okay, thank you.
Thank
Bye.
you very much. Bye.